Hello and welcome to everybody. I'm Devashish Basu, trustee of Moneylife Foundation and editor of Moneylife magazine. I'm absolutely honored, delighted, and pleased to welcome Mr. Venkat Jasti and his team in this special series of interviews we are conducted for the Corporate Governance Awards of Moneylife Foundation. This is our inaugural year. These awards are unique because they are completely merit-based, independent, and chosen from recommendations by some of the most insightful investors in India. Suven is one of the 5 finalists for 2021. Thank you, Mr. Jasti, once again for agreeing to participate in this conversation with me and Balakrishnan. Our Balakrishnan. Bala is Moneylife columnist and a very well-known market expert with over 4 decades of experience in investments, research, credit rating, and fund management. Interestingly, of the 5 finalists, 3 are pharmaceutical companies and all 3 are from Hyderabad. I would like to start this conversation today by asking Mr. Jasti, what has been your experience in negotiating the Indian business environment, since we are talking about the issues of governance, given that the environment imposes a lot of challenges in the smooth functioning of businesses in India?
As you know, government frames the rules and regulations, but unfortunately, they don't follow what they want to preach us, and they expect us to get to the things which are sometimes contradictory to each of other regulatory bodies, and everybody has their own focused mind, and they don't see in conjunction with each other. That's the main problem we face, and at the same time, it's a process where we have to tell them how this works in the real world, and sometimes some people listen to us and some people don't. So we have to make amend the roads and all that stuff, and that's a part, of course, of the way you have to do business. And that thing is. But as long as we follow the rules and regulations, whatever that comes in, it's only a delay in certain aspects, but otherwise it's a good going.
Well, I think, sir, you spent considerable years in the United States running a chain of pharmacy units, in retailing and I think dispensing. Now, when you made the choice or the decision to shift to India and set up a company, were you ready for the challenges from the system, which generally are huge deterrents?
Yes or no. The reason being, at that time, everybody who comes to the US says that come and invest in India. Not that because they told us I came here, that's not the case anyway. But what they're saying is come and invest in India. And you cannot, in the day one, you cannot bring everything along stock and barrel to start the business. So you start the business from there and then come here. Then we have the problem with the RBI, with the things that the money has to, even for the repatriation benefits, there we have to go through a system where they said it's not, since you came into India, you did not stay there and invested there, so we cannot get the repatriation. Then I have to hire Swaminathan and Ankleshwar Iyer at the time to fight that case on principles rather than anything else, because not that I want to take it back, but don't say something which you don't mean it. And how do anybody know that I can have to stay there and start a business here, which is not at all feasible, right? So I have to come here and start. Even though we bring in dollars at the time, you don't have the right to repatriate. That's the kind of situation we have to go through. Then, of course, I've gone by it's not that I want to start a pharmaceutical company to start with right away. My aim was always been innovation side. So the opportunity has come for a financially sick unit available which my friend has looked into it, and he could not take it because of the problems with the bank. So he told me that, yeah, if you are interested, you can take it. And then it has gone for a second bid, and at the time I bid for it and I got it. So that's the way I started. Not that it's a planned way of doing things, but it has come in such a way that when I came back, I thought I want to take a rest for a year before I start doing something, but it has happened within a month's time. And the minute I took over from the government, different departments came in. You says you did not pay that. You have the liability with this and that. I said, when it is on an auction basis, when the question of liability comes in, and all those things which we have to go through, of course, and this is the problems we face. So, to be honest with you, we're not really prepared, and I did not plan to start this way, even though intent is there, but things has happened. And of course, on the way, problems are also there, but at the same time, we could ride the road, rough road.
What were the ethical dilemmas you might have faced, if any, at that time?
See, from college, I only, I was in Andhra University, then I worked only 1 year in Warner, Hindustan, and straight away gone to USA. So I didn't have much things to be done in my adult life here. But when I came back here and I want to start, and when I go to an office to sign off some papers for the state tax, all those things, you have to go to the office to get signed off, something like that. We're being a small company, Then the guy, 100 people are sitting in the room, and the guy asked straight and a loud voice, yes, I get this much and the government gets this much. Then I was looking around saying somebody is going to look at me and arrest me. That is the last time I went to the offices. I said, this is not the way I can do. That's the way, that is a very frightening situation. And that time onwards, I said to our people also, go by the book only, don't do anything, because I don't want to get caught for nothing, because it's not you, that's anybody under your management does also will affect us. So that's the kind of situation. These things will certainly delay some of our things, but still we are, not that we don't do things, but still we are trying to do the best we can to mitigate these activities by going a straight line.
For a long time, there is a book on it also. Indian pharmaceutical companies have had a series of run-ins with the difficulty in getting FDA approvals, straight approvals. All complete, all the inspections that they do. There have been reports. Even now, one of the largest companies is still struggling to get to clean chit for one of its plants. So you are among the smaller companies. Of course, now you've grown, but at that time you were among the smaller companies. And even today, there are smaller API manufacturers who seem to have had no problems. Eventually, you all have got a clean chit and you managed to handle things. You managed to do things obviously very excellently. Is there a fundamental difference in the earlier group of companies, though they are much larger, and the approach that you have, or the newer generation, I would say one generation later, those people who have come up? Is there a difference? Is there a fundamental difference? Or is it just a unit to unit difference?
Yeah, the fundamental difference is mainly the FDA is not sacrosanct. The people that comes in are have discretionary power, the way they audit. The people, they're not technical in nature. One of the guys who has come to visit us, they get a checklist, that's all, because the guy is doing in California a real estate business. And he was hired into the FDA, and he comes in and he does this. The way they approach the problem is everybody has a different things. That is one of the major problems which you face. And the second thing is the training. Training is the mindset, rather, not the training. The mindset of the Indian people are mainly the problem, actually, rather than they don't blame the FDA itself. Because I tell my guys, if you make a mistake, first of all, you should not worry about making a mistake. Unless you make mistakes, you don't also happen. Everybody makes mistakes. You admit first to the management itself, and nobody is going to do. Based on that, you learn the new things, and also, especially in making the papers and the documents, when you make a mistake, you just strike it off and write on top of that what is right. Nobody will question you as long as it is a genuine mistake. You did something. And if it is an adjustment you have made, you also make that clearly. Even then, if it's wrong, also they will tell you it's wrong, but don't do it. Otherwise, what our people will do, they take that paper out and they put a brand new paper, putting all other lines, and this line should not be there. That means when you see a book, a production book, when you see everything clean, and I mean, that gives you things. I mean, that is mainly the mindset of the people who are at the forefront, and also the mindset of the management who don't insist on that. And added to that, nowadays, vigilantism, kind of a vigilantism from the inside only, since the ran back people got the money who has told about their misdeeds. They got paid so much money. Since that time, some of your own QA, QC people who actually makes mistakes and who cover up to the management will blabber it out when they don't get a promotion, increment, and all that stuff. So these are all a combination of things that are happening. It's not that you cannot blame FDA for itself, except for one thing, which they give too much discretionary power to them. And the way you have to do certain things. Somebody says, if a powder falls down, I said, I'll take it out like this. And the other guy says, no, you have to take like this. These kind of things makes, and also the media also. I mean, they don't see the difference between the warning letter versus the observations. I can have 10 observations. These are all procedural in nature. And sometimes in the good olden days, that means 10, 15 years ago, at the end of the day, they tell, oh, if it's a procedural in nature, and then we explain it to them, then we give the new SOP, then they agree, they only write, but they don't write as a number as a number. But nowadays, they said, I only audit you, I don't listen to you anything, everything you write it to the agency themselves directly, the inspector don't have the time for that. So what happens if I make a 10 observations which are very small in nature, but the media takes it a big way, and if it's a listed company, the stock goes down or up and off. And I get, suppose 8 observations, but I get in 15 days, my report comes back, says clean and green. But sometimes I may have one observation that is a technical observation, and for that I need to do the work, and give that may take 6 months' time. These are the kind of things that are happening. And,
but I think by and large today, things have, both at the analyst level and the media level, things have become much more mature. And they are reacting to serious issues more these days, and not just observations. And it is a fact that there are a host of, we don't have a problem in naming names, but there's a host of largest of the companies are struggling to get through these, whereas the smaller companies like whether it's Newland or you or Laurus, earlier Divi's is a large company, none of you have facing. So I would assume that it's management quality and what directions flow down the line rather than the external factors that you're pointing out.
That's what I'm saying. Management mindset and management training and management existence, and as the groups are becoming bigger and it's becoming unwieldy, and they cannot see all the people, they cannot interact, and one bad apple is enough to spoil the whole process.
How do you look at your board composition? There are independent directors, there are family members also. So, what is the weight, or are there any instances where the independent directors actually make you pause or make you think?
If you see, I never had more than two people on our board from the promoter family.
Okay.
That's the maximum we did. And my wife was there before the merger, and she's myself. And after that, my son-in-law was there, and these are the only two. My wife is not there, like that. So we took, if you see our board, one financial and one technical. These are the minimum requirements. I look into it based on my board composition. You can see, so I can because depend on them for the thought processes and think tank and all that stuff. I think it's better we have the best people to give us the guidance. That's what the board members are helping us. That's why I did not put any more, even though my two daughters are working with our company, we are not putting them on the board because we want everybody to be to and what do you call that think tank for us in order for us not to go into various ways and at the same time be on the straight line.
And what about any business dealings with other family members or anything? I see that you kept yourself away from those as of now. But do you have a stated view on that?
Yes. We don't take any. There are a lot of people who want to invest in our company. I said you can go and do whatever you want, but as promoter group, I don't want to come into the picture because I don't want to be responsible. I mean, two things. One is on the corporate governance side. The other thing is on the family side. I don't want to have any trouble with the family side also. And also, if you see, the only what do you call the insider trading or whatever you can call related party transaction.
That's exactly what.
Only thing we have is because of the demerger of the company, the other company is utilizing our thing, which is gone through the board, gone through the general body meetings, everything is, and the limits are set and thoroughly discussed. So other than that, I don't hear anything, and we don't have any other business also.
And sir, if I may ask you, as the CEO, if you're looking at the MIS every day, what are two things you focus on?
By myself to the customers, and which in turn for the organization, and commitment from my employees to the organization. These are the two things I look at it.
Okay.
Commitment to deliver, commitment to be transparent, and these are the two main things. What do we look for?
Can you narrate one or two people or books which have inspired you in your journey so far, sir?
Actually, I mean, to be honest with you, no. As I said, from the beginning, during the college itself, my intention is to go into the research.
Okay.
And in 1974, I went into, I want to go to USA as a student. But when I applied for a visa, applied for the universities and all that stuff, I got a green card in Chennai itself. Because that day, we don't have any, we're short supply of pharmacists and doctors those days, and they used to give the green card here. So that's the way I went, but the year I went is the very bad year, the highest unemployment, no jobs, no person. Then I went into kind of jobs, very labor-oriented jobs before I got into the pharmaceutical thing. And I also came to know that time we don't know much about the pharmaceutical dispensing and the good remuneration you get there. So either you want to do research or you want to get into the pharmaceutical industry, the manufacturing area, or whatever it may be. But I went into a soup industry to do a quality assurance part, then moved into the pharmacies, and after passing the local exams, and then of course I started developing it, and I am the first person to be registered as a pharmacist in the state of New Jersey, because at the time Indian pharmacists are not allowed. I was going to college in St. John University, New York, and one of the teacher is the Board of Pharmacy president himself is a teacher for us. We used to carpool from Newark to New York, and I fought with him and saying that we can teach, because our teachers are Indians only, other teachers also, and they can teach, but they cannot practice pharmacy. What is this nonsense? What we tell? And one of the local pharmacy association people in New Jersey also supported me. And they gave me as a separate one-time chance as an exception to write the exam 2 days before. They gave me an opportunity, and of course I passed through without any problem. And of course now after that there is a NAPLAX, which is National Association Board of Licensing Exam, and all that stuff came in. Now everybody can come in. So that's the way we have gone through that. Then again, we started with one pharmacy, then of course slowly gone into multiple pharmacies before the journey there.
Amazing, very, very interesting. Thank you for this.
There is often for thoughtful companies which are investing for the long term, there is sometimes a conflict that happens with the objectives of investors, who could be little more short-term oriented than the entrepreneur who has to necessarily take a long view. This especially came up because you were investing heavily in the discovery side of the business also, which you have now demerged. So what are your thoughts on that? Have you felt any pressure, or you've not felt ever any sort of pressure, or you don't even think of that? How do you handle this?
I mean, pressure has different connotations. I mean, see, when I started this company, as I said, it's not by design, but it has come as a matter of going through things. And when I started, this is a bulk drug manufacturing facility I took over as a financial company. And within 2 years, I saw this is not my cup of tea. And because I was sitting in Mumbai to get my collections, because cash flow is the problem, because we have to supply and get your money back, and the interest rates are high and all that stuff. Then I said, this is not my cup of tea. Then I thought I should do something different. Then I moved out within 2 years into one of the areas where I do the specialization is the sodium cyanide reactions, which not many people do, which is a dangerous reaction. So I said, why not I specialize in that and do some chemical intermediates and pharmaceutical intermediates in that, and so that I don't have this kind of problem, valuation will be there and all that stuff. It's a bold step for a herd mentality. That's what we have in the pharmaceutical industry. If I start the same thing, he will start the same 10 people will do the same drug and all that stuff. But at the same time, I could move out of that. And I could be successful within 2 years. Then 94 came in, as you know. At that time, the government agreed that by 2005, we'll accept the intellectual property rights. And at the same time, I have an opportunity with a big pharma in 1994 to set up a caffeine plant. That's with Pfizer. Set up a caffeine plant in India in a three-way joint venture with the DuPont and Pfizer. And they said, we would like to work with a listed company rather than a private company. That's why I plan to go for IPO in 95, which is again a very bad year for IPOs. Everything is bombing out. At the same time, this GATT and TRIPS agreement and 2005 things is there. So I have thought of myself, we are now going to involve with the innovator company, even though it's not an innovative product. I should get into the supply side of the innovation. That's where I put the word during my IPO. I have coined the phrase called CRAMS, Contract Research and Manufacturing Services. Unfortunately, not having the culture of trademarking it, I did not do it. But now that became a global name, as you know.
Yes.
We clearly mentioned in our IPO itself clearly that we'll be in the supply chain until 2000. We'll be in the supply chain of the innovators. That means working with the global players during the clinical phase of the drug development, supplying chemistry-based intermediates at various stages like phase 1, and if it's successful, phase 2, and that is successful at the innovator level, phase 3, and if that is successful, supply to the launch quantity like that. So people thought this guy is crazy, and people did not understand what CRAMS is all about. They thought it's a CRAMS. But whatever, we have been working on that, and the people like Pfizer, they have given us the good reference that these guys are capable of doing chemistry. Otherwise, for a small, tiny player like us, going into supply chain of the innovator and sustaining is a very difficult provision. The other thing that gave us the inroads is knowing fully well the first kilo you supplied, maybe the last kilo you supplied. Nobody do that kind of business. That means you are taking a high risk business. That's why the success rate in this is less than 1%. We have done more than 900 projects, and it's less than 8 compounds we have, and those things are only. But at any given point of time, you don't lose money because it's an R&D based pricing we do, and even though success is not great, the bottom line is good. That's it. We have gone there. And later, when we have gone into the 2005 came in, as you know, we as promised, and I thought of keeping the same crimes where the connotation changes from contract research and manufacturing services to collaborative research and manufacturing services. That means bringing the innovation to the table. That means IP into the system. That's where we started. Again, we thought IP, what do you call, you don't want to get into the run-of-the-mill kind of a products. Then we said we had to go something which is very difficult proposition where you can get the recognition much easier. That's why we chose central nervous system disorders. The central nervous system disorders, as you know, it's as we are living longer and healthier, but we have a lot of old age problems which we need to take care of. And more or less, all these things are not having any treatments. It's only alleviation of pain or dementia or whatever it may be. So this is the kind of things we have taken. And as you were saying, did you get in any pressure? Because there's no point of pressure, because we have been telling people, this is my business model. This is the way it works. It has highest risk. And reward is also there if it comes, but there is no guarantee. So we have been very truthful to ourselves. We know very well what we are getting into in terms of the CRAMS side of the business, which is revenue generating, and inside the collaborative research and manufacturing services, which is the drug discovery and development support services. And to do our belief that within a year and a half, with one of the CRAMS player who saw us doing things in the CNS system, they became our partner and the on partial funding basis. There is Eli Lilly in 2006 itself. And of course, it ran for 4 years. But again, 2010, when the global recession in pharmaceuticals and reprioritization, all the R&D funding is gone. But we have continued our journey by plowing in 90% of the earnings that is comes from the revenue part of it. So we've been telling everybody, including investors, we never give guaranteed things. And we also believe that it's not going to be, yes, it's a dream, no doubt about it. And it's also to take care of the diseases for the unmet medical need, not necessarily in India, but globally. That's our intent. And we are going in the same direction. I mean, we have no change in whatsoever. And whenever, if you see my transcripts and all that stuff, we clearly tell them a lot of patents we got, about 1,600 patents. Doesn't mean a thing. It's a necessary evil. Without the patent, you don't have the right to work on the innovation later. And that's the way we do. So whatever we thought, I mean, as I said, it's not by design, but at the same time, it became a design by itself. Keep going away as the opportunities arises and focusing and keep the focus and don't deviate from the focus and no matter what. That's what our aim was and is and will be.
One last question. What's your view on acquisitions, sir? Are you open to buying companies?
Maybe, but the business model I am in, the things I may not be able to get matching the requirements. If I need only for manufacturing purposes, yes, I can. Even now, I don't mind if some other opportunity comes in and if I have the products to put it in there. But as a innovation-based activity, until I'm successful and I have enough, because I need to conserve cash either in or out to do the things which we have full platter. So we need to have some benefit out of it immediately, but on the innovation side, I don't think so at this time.
I have one last question, which is that the over a period of time, the market regulator has talked about increasing sort of processes in corporate governance, okay, at the boardroom level, at what the company should do at the disclosure level, and so on. It has gone through 3-4 of these iterations, and increasingly, it seems to us, at least from the outside, that a lot of it is quite onerous, quite, and sometimes they do not, may or may not meet the real objectives of what these are intended to be. There seem companies can have a checkbox approach and get away with it. For instance, I'm just giving you an example, not that I'm saying anybody would do it, but they can if they want to. So what are you, as a practitioner, as somebody who's actually running the company and you have to do or go through all this, what is your reaction, and if you have any suggestions how it can be improved or streamlined? What are your thoughts?
Yeah, I mean, as a practitioner, I have no choice but to follow whatever they preach. But the problem is the corporate governance. I mean, somebody like you, I mean, you have brought up this new concept of doing things. It should not be mandated. That's what my gut feeling is. That means if I want to do things right, I mean, you should be able to appreciate what I'm doing. Not because government told me to do, then what is the big deal about it? I don't understand that. Similarly, in the CSIR, we used to do a great job to do the things what we like and where it's supposed to go. So mandating corporate governance is the ridiculous thing I can think of, but that's not me. I follow as a practice. But if you leave it to us, I think we can show, I mean, we can, not only us, many people can show their mettle. Then you can decide whether this guy is following government regulations or the good corporate governance. Following government regulations is not a corporate governance. We are just following meagerly. That's all I feel.
Thank you so much for being absolutely candid. It's been a great interview. We really enjoyed talking to you, Mr. Jasti, and we wish you all the best.
Thank you for the good work you guys are doing, because this is what needs to be recognized rather than just ticking the boxes.
Absolutely.
That's
Thank
right.
you so much.
Thank you so much, sir. I think we look forward to your joining us on 6th of January.
That's right.